By the year 2030, 1 in 6 people in the world will be aged 60 years and over, according to the World Health Organization. My name is Louisa Baldini. I'm a former BBC correspondent, and I'm delighted to be leading this conversation, a global approach to healthy aging. And I'll shortly introduce our panel to you, but I just wanted to conclude my introduction by saying that global aging is usually regarded as a positive consequence of advances in medicine, science, and technology. However, it is crucial that we, as a society, work together to ensure that quality of life is not compromised as we get older. To do this, we must continually optimize on the opportunities to maintain and improve physical and mental health and independence. So in this session, we're going to discuss some of the most successful initiatives currently being implemented, as well as future plans and projections for healthy aging from a global perspective. So now, finally, to the panels that we have here, whilst we're still trying to bring in our virtual panelists. We're joined at the end by Dr. Shamila Shimayala. No, I've said that one wrong. It's the difficult one. Say it for us. Shamila Shimayala, Senior Consultant Geriatrics, Hamad Medical Corporation, Qatar. We have next to me here Paola Barberino, who is CEO of Alzheimer's Disease International UK. And in the middle, we have Dr. Reshti Akdab, Head of Neurology at Amman Hospital here in Qatar. Joining us online, hopefully shortly, she will appear, is Dr. Ritu Sadana, who is Head of the World Health Organization Secretariat Council on the Economics of Health for All. She's Unit Head of Aging and Health. So she will be popping up. Where is she speaking to us from? Geneva. So, whilst we wait for her, to our panelists, and please, when you hear what they have to say, think of any questions that you will want to put to them, because you will have plenty of opportunity to put your questions to them. And if anybody's watching online, I think we're online live streaming, please do submit any questions via the app, and hopefully we'll be able to put those to the panel as well. So, Dr. Shimayala, as the national lead for healthy aging in Qatar, can you tell us about the achievements, challenges, and future projects tied to the Healthy Aging Initiative in Qatar?
Thank you for this
opportunity. I don't think the mic's working, I'm afraid. Do we?
Is it working now?
No, that was me. Yeah, I'll pass this down.
It's working.
Yes. Is that better? Yes. Thank you for this opportunity to present the successes of healthy aging on this platform. First of all, I will just correct that Dr. Hanadi Al-Hamad, our chairperson of the Department of Geriatrics and Long-Term Care, and the medical director of Rumaila and QRI. She is the national lead for healthy aging, and I'm fortunate enough to be on her task force and help her with some of the initiatives. I hope so.
It's been a very busy conference so far for any of us.
So, and I think we heard some about her in the previous report presentation. So just to give some background, the National Health Strategy 2 was rolled out in 2018 from the ministry. It was a 5-year project, 2018 to 22. So we are, reaching the end of this project time. And the elderly population was identified as a priority group in the strategy. And fortunately for us and for the population, I would say Dr. Hanadi was nominated as the national lead. And what it did was it gave us a framework on which to align all our efforts that we were putting in for the elderly, and it gave a framework from starting all the way from research to cover all the services, including prevention and, as we said before, to palliative care. And not to forget about dementia and the work that we are doing for the cognitively impaired population group. So just to give a little bit more detail, we had 6 initiatives. One of them, one of the key successes that I want to point out, and I'm also the lead for that initiative, so I'm happy to report this, is the health literacy initiative. Health literacy, as you know, is making the population knowledgeable about their health conditions so that they can discuss with their medical team and make informed decisions about how best to manage their medical conditions. So what we aim to do is provide that information so the elderly or their caregivers can utilize it. And we were successful with the help of our communications department in launching a website, which is a healthy aging website. It came out in 2019. It is under the Hamad website, and I think it is one of the first websites that came out under this strategy. And it is reviewed by healthcare professionals and providing all information about elderly conditions as well as the resources that they might need, including all our geriatric services. So that was one of our early achievements. We also managed to send out periodic SMS messages to our elderly population as well as conduct face-to-face awareness programs. This is, I think, and we also have training programs. Including collaborations with ADI and Sanad, of course, training programs for our staff, which has been ongoing. Including collaborations with ADI and Sanad, of course, training programs for our staff, which has been echoed or echoed or all right. So that is one of the health literacy part. Then we go on to prevention. So that is one of the health literacy part. Then we go on to prevention.
Technology is not on our side this afternoon, I'm afraid. Sorry, ladies and gentlemen, please bear with us with these technical issues.
Sure. I'll start again.
Press on.
Yes, I think that's better. So next was to enhance services to promote a healthy, active aging, and this part we focus on prevention services, which include a vaccination program. As we know, adults also need vaccinations, and there are some key vaccinations you need to get when you're 65 and above. So we managed to develop a vaccination schedule for the elderly, and this has been approved by the Ministry of Public Health. We also focus on risk factor reduction through a new wellness clinic that was initiated in Qatar Rehabilitation Institute, as well as implement screening programs with WHO. The current program that we are following is the Integrated Care of Older Persons, ICOP. Again, training has been completed, and we have a good take-up by the primary health care centers who are collaborating with us to roll this out across the country. Now, another initiative again regarding services is, the elderly need access to healthcare. They need easy access. So that was one of our other areas of focus. So from we mentioned already about prevention and screening tools. We, as Dr. Shafi mentioned in the previous presentation, although COVID put us back in some respects, we did manage to get various new services implemented during COVID times, including the acute frailty unit or the acute geriatric unit in Rumaila Hospital, which has long been a long-term care hospital, but we did manage to get the acute unit established during COVID time. And one of the crowning glories, I would say, of our achievements during this period was the elderly urgent care unit. I think it was established in 2019 or 2020 times. When the elderly had difficulty getting to the ED, because the ED was probably, or some hospitals were reserved for COVID, and it was always high risk for them to go to the emergency department, Dr. Hanadi managed to open this urgent care unit in Rumaila, where the elderly can just come in any time, specifically from 7 a.m. to 10 p.m. They could come in and get themselves checked out by a geriatrician and get the management also done within a very short time. So that was one key achievement, and again the phone number is listed on our website if you would like to get in an appointment there.
Dr. Shamila, I'm just wondering, what was the take-up like of some of these services?
It was our urgent care unit. It was excellent, excellent. So in the beginning, and again, some of it depends on knowledge as well. As we said, the health literacy correlates with this. So people have to know about the service, and that's what we are doing. We are sending out periodic messages, or press releases, or something to inform the elderly that this service is available for you, and now the home care services is with geriatrics. So the home care physicians, they can also refer their patients. If they need more of a detailed evaluation, they can refer them. So I think from the beginning, maybe the numbers were low, but now our urgent care is pretty busy. As I would say, our nursing lead is here. From 7 to 10, it has been quite busy these days.
So some really practical and actionable initiatives that you put into place to help and also get the elderly population more involved. I just would like to ask Paola Barberino, that's all very well, but if mental and cognitive health is impaired, then that context of the healthy aging policies and these initiatives, that slightly skews things, doesn't it? So what has your organisation, Alzheimer's Disease International, done in this space?
So for us it's very interesting because we're talking about healthy aging. So to me this goes back to what are you going to do to ensure that us as a population are aware of what we have to do to age healthily. And it's very important to remember that there are things that we can do from when we are very young. There are things that we can do when we are in our mid-age, and there are things that we can do when we are older. And one of the things that we see sometimes is that certain governments, for example, emphasizes the messaging to the young that they can do something. But actually we can do something in the whole course of our life. And obviously we focus normally on dementia. Dementia is the 7th leading cause of death globally, so it's an important thing to focus on. And when we look at some of these factors, they are addressable at an earlier age. Things, for example, like your diet, things like not smoking, things like not drinking alcohol, or doing all of these things in moderation, or being aware of them, needs to be done at an earlier stage. But also we have to be very careful, because we can tell people two generic messages. You have to be quite specific. And there are things that have to do specifically with our disease, with infrequent social contact. If you don't connect with other people, your brain atrophies, and we've seen during COVID. If you do not wear your hearing aid, which is something that has come up quite recently in the context of older people being diagnosed with hearing impairment, and their cognitive impairment deteriorating, that is a big issue as well. And I have been looking at examples where governments have been taking these into their stride. And there are governments in this world which are saddened with great amounts of people living with dementia amongst them. They have started programs where citizens in their 40s and 50s go to classes where they can be trained about how to adopt healthier behavior. But this is one of the tricky words, and perhaps we can go back on it later. Adoption of behavioral change. This is something that fascinates me, because we all know that certain things that we do are bad for us. I always know that I shouldn't be having a packet of crisps. Alas, do I have that packet of crisps? I have the packet of crisps, in the full knowledge that that's definitely not going to do me any good. So how do we actually change behavior? It's a big task of governments. It's a big task of individual hospital, where you see people, and a lot of primary care doctors, family doctors, say, how can I have that conversation? What really changes that conversation? And perhaps we can talk about it a bit later, but there are some impactful techniques on how you can have the big conversation and the trust between a doctor and the person that asks for help and changing behavior.
Thank you, Paola. Everything I've heard so far very much makes me think, well, this is all very well and good in an ideal world, that the elderly would take to these initiatives, that they would start, that people will make changes earlier on in their lives. But even those people who do live healthy lives can end up suffering in old age. So what about the hidden elderly population who just do not have the ability through maybe mental health issues to do anything that is going to help them continue to age healthily. And so to Dr. Reshti Ahdab, I want to ask there again, you know, you're going to talk to us about innovation and technology and how that can help the elderly. But again, it's like there will be some who are capable of using technology to help themselves stay connected, stay young, and there will be a whole swathe of hidden elderly who just don't have the capability to connect with technology.
Yeah, sure. I mean, definitely the incredible advances in science and technology have helped a lot keep our elderly living individually at home, in fact, in their comfort zone.
What sort of, could you give us some examples of
Yeah, sure.
technology?
In fact, this problem has been addressed classically in two ways. The first way is to get the environment around you more friendly for them to be able to cope with the complexity of the environment. And in that regards, there are endless solutions to pretty much everything they might face, provided, as you said, they have the minimal resources in terms of cognition, in terms of motricity, in terms of sensory functions to be able to interact. I mean, just take a look at your smartphone. There are billions of things you can do. You can schedule your medications, you can schedule your activities. There are sensors you put at home to monitor their activities. So there are lots of solutions. But the other way, and I think it's a bit more interesting to answer your question, is that now we have the ability to enhance the brain. And this is done through weak currents, electrical currents, or magnetic pulses. And these are known as neuromodulation. So these techniques, we go and stimulate areas in the brain to enhance their function, either to help them cope, okay, with what they've lost as skills, or at least get their brain up to the challenge to be able to interact with these pieces of technology. And the technique that has shown most promise is RTMS, which stands for repetitive transcranial magnetic stimulation. And these machines are coupled with a neuronavigator, so you can go and it will generate a 3D model of your brain, and you can go stimulate specific areas that have to do with attention, that have to do with language, with executive functions, and all these things that the elderly find it very hard to do. And in fact, the major problem in elderly is the speed of processing. So if you can get them to process all the information that's coming from the outer world more rapidly, they will be eventually able to tackle the problem of technology.
Thank you very much. Very interesting there about the RTMS, for example. Well, you'll have seen that we have finally got Dr. Ritu Sadana on the line. Good afternoon, Dr. Ritu.
Hi, good afternoon. It's great to be here virtually, unfortunately not in person.
Can you see us all?
No, I cannot, but I can hear you well.
Okay, that's good to know. Just wanted to establish that. So hopefully you can hear us very clearly. And so I wanted to ask the World Health Organization, its member states and the partners for Sustainable Development Goals established the Action Plan for Aging and Health for 2016 to 2020 and its continuation through the WHO programme on the Decade of Healthy Aging, 2020 to 2030. So can you tell us more about the goals and anticipated outcomes of the initiative, and if you could provide examples of countries or projects that have done particularly well, that would be great.
Yeah, I can. I'm going to share my screen. Because I'm not there, this may be then a little bit easier for me to explain. Can you see the screen?
Yes, thank you.
Okay, so in terms of the global strategy, WHO member states agreed to the global strategy back in 2016, and it really established clearly what we mean by healthy aging, that it's the process of developing and maintaining the functional ability that enables well-being in older age. There's a couple of really important
The sound is not coming there.
still hear us? Dr. Sadana? And we've lost contact. But luckily we have our 3 live panelists here. So you know, we were just talking about technology with Reshdi, with Dr. Reshdi Mahtab.
Hello?
Yeah, sorry, we lost you for a couple of minutes, so if you could just reprise, please.
Oh, okay. So can you not see me, or you didn't
No, we
hear me?
can. We lost your audio briefly
Oh, okay.
for a couple of
So
minutes.
I just mentioned that what was important from the global strategy that's till 2030 and the action plan that was the initial 4 years was that it established the importance of functioning as the goal of healthy aging. It included for the first time in a WHO resolution the importance of all countries to develop long-term care, not only in institutions but also at home and in communities. And it helped set up the decade, and it encouraged all countries to help set up the decade. So subsequently, we, in 2020, had a UN General Assembly resolution to have a decade of healthy aging from 2021 to 2030, which is aligned to
We've lost contact again, as you can see. Has anyone got any questions so far on what we've heard that you would like to put to any of the panelists? Any of the initiative? Yes.
In fact, it's at
it
it's at
also
a private
includes an action
hospital
area
at
on
Amman,
combating
and it
ageism.
is relevant.
And then there is an action area on enhancing integrated care for older persons that looks at a person-centered approach. So I think someone already mentioned, for example, physical and cognitive functioning abilities, capacities, as well as others, whether it's hearing or visual capacities. And a third in terms, another one actually on long-term care. And I've provided all of the links for those who are interested to find out more details. What's important is that we look at functional ability, and we've been looking at this since 2015, and we describe it in 5 different ways. There may be additional things that people care about, but it's really about enabling older adults to have the well-being based on how they define it. So obviously, meeting everyday basic needs for food, shelter, and clothing, including the health services they need, is core. Staying mobile, that means being able to get where you need to go in your environment, even if you have difficulties in your own physical capacity. Building and maintaining relationships, continuing to learn and make decisions, and contributing to family and communities. And we're not focusing only on economic activities, but a wide range of activities that older persons value. Finally, in terms of looking at examples from around the world, we've been documenting with a wide range of countries their efforts to improve monitoring and measuring meaningful impact, including with Qatar. And there are many countries that are doing this and are trying to improve and working with a wide range of stakeholders, including ensuring that they have the active voice of older persons themselves. They also realize that it's not only about the health sector, but looking at the broader determinants of health so that you can actually shape better opportunities older persons have. I think one of the speakers was describing, changing lifestyles and making better choices, but the environment needs to be conducive to allow people from different backgrounds and in urban and rural settings to be able to make those choices that are healthier and better for them. Just to end, I want to mention that we developed a pathway to try to illustrate why innovation is really needed in this area. Because we know that evidence alone, or even good policymakers alone, are not going to make the change at the scale we needed. So we tried to come up with a simple heuristic to help us think through what needs to be clarified, identifying the interventions to address the problems, promoting, designing, and assessing in pilot projects or in small areas, evaluating them so we understand not only what needs to be done, but how it can be done better, and then ensuring that we reach those who are currently excluded to improve health equity. And then we know we need to accelerate impact because we have a goal to make a difference by 2030, and this requires us to use different means to actually go faster. And that includes fostering research and greater innovation. And I want to mention that one of the things the Council on the Economics of Health for All at WHO is trying to promote, and I'm also leading the Secretariat's efforts in that area, is that we need a system that delivers public value, and we have to actively work towards it. So the decade has a couple of, several different enablers, but state capacity and leadership is really important because the state can shape and co-produce with private sector and with civil society what needs to be done. So I have put up a table that tries to show what are different ways that the public sector can actually promote investments in the areas that can support older persons as well and build symbiotic public-private partnerships. And this includes, for example, the way we finance innovation so that it includes setting up, on one hand, investments earlier in life that put people on a better trajectory, but also investments that are inclusive of older persons. Often we want older people to volunteer, but we don't want to invest in actually the means and the environments for them to be able to pursue those functional abilities I described. So I'd like to end on just 3 or 4 examples from countries. In that baseline report for the decade, we've got something like 60, 70 examples that show different projects in different countries around the world that are doing, for each of the abilities, really neat things. So I really encourage you to look at the report. For example, a group in Pennsylvania, USA, put together a program on how to provide care for persons with dementias within their environment. This small project, which had only like 150 homes in one community, was analyzed in depth and then replicated in many, many other states. It's very important that this sort of scaling up occurs when there's a good project. There's another program that benefited from analyzing seniors, university programs for seniors from around the world. And the group has actually now scaled up where they have more than 2,000 people from Beirut who have, from ages 50 to 95, who are participating from a wide range of backgrounds in this lifelong learning program. It's been very successful, and they've been enhancing it in every year who participate. Another example is from Italy, and it's their national network for active aging called AUSER. They have approximately 46,000 volunteers. They've donated more than 8 million hours per year, and they focus on social rights and community welfare of older persons. And older persons themselves are part of the force, but they really try to do a wide range of programs and a really fascinating, enriching program that the Italian civil society has put together. And just to close with one that was developed and is in progress by a national government is from India, where the National Health Protection Scheme and Health and Wellness Centers, which is called Healthy India, includes as one of their 13 modules healthy aging. And they want to accelerate health and wellness by removing barriers to access comprehensive care services. And this complements the national program for health care of the elderly. I would also like to talk about Qatar because they've been doing fantastic things, but I think you have other speakers on the panel who can do that. So these are just some examples, and we have many more from around the world where countries are, and programs with civil society and public and private partnerships are really trying to move from only looking at diseases to really supporting older persons and working with older persons so that they have the functional ability that allows them to be and do what they value.
Thank you, Dr. Ritu Sedana from the WHO Secretariat. Thank you very much indeed for that. At this point, let's pause for those questions. If anything springs to mind, we would just, Reshti was finishing answering about the RTMS.
Yeah, sorry, so it's in Aman Hospital, in private, and it is quite expensive because the running cost of this technology is quite expensive.
What's the success rate?
The success rate, in fact, to be fair, the technique was approved, FDA approved for major depression. And so we know that, for example, in these diseases, in these disease states, the success rate is 50 to 60% in people who have failed all medical treatments. So the idea is in terms of cognitive impairment and dementia, we don't have real numbers. Okay, so we don't have those big clinical trials they've done in depression and pain, chronic pain and other things. But we have a handful of very well-designed studies that show that it improves the cognitive function in general and specific cognitive functions depending on the target.
And that's specifically for elderly people?
It was studied on an early Alzheimer's disease, mild cognitive impairment, and even people with no cognitive impairment at all, just to enhance their brain functions.
Fascinating, thank you so much. Any other questions from anyone here in the room? Please, you can put any of your questions to the panel. I wanted to ask about the economic case for investing in healthy aging strategies. I mean, we were hearing there from Dr. Sedano about public value. You know, so I guess there is overlap there because, you know, we're talking about the economic case, who's paying for this, things like that, technology, private on the whole. But who would like to talk about the economic case? Paola?
Well, I can say something around the cost. We have been doing a lot of studies, of course, to demonstrate that doing certain interventions at certain stages in the dementia continuum can actually lower the economic cost. And you live in Italy, you will know there's been a law passed recently in Italy, for example, to allow carers of people living with cognitive impairment to receive welfare so that they can continue to work. Because of course a lot of people have to abandon work. And I have to be clear here that women are by far the most hit, because not only they develop, sorry, there is no microphone. So women are by far the most hit because they not only they develop dementia more than other people, more than the male population, but they also, of course, are hit as carers and often have to abandon their careers, and there are other repercussions, of course. So it's important to support people in their caring duties, because then they can make an economic contribution to society by continuing to work. But I could give you a lot of examples when that is the case. In certain countries, we are focusing specifically on that. I should mention that D.Y. Suharia, who is with me today, Dr. Ritu was speaking about the decade of healthy aging at the UN. She's just been nominated one of the 50 global influencer on that very process. And we're doing a lot of work in Asia in particular, where psychologically and culturally, the work that families do in their mid-age towards their seniors is different from what we do in Europe. And so there is also cost that one has to consider insofar we are not having the support mechanism that there used to be. In England, for example, where I live, a lot of people live alone in their elderly age because their families are not supporting them at all. And again, there's a cost to society because, of course, you have to provide carers that go around the country and help in that respect. Somebody was mentioning in a earlier webinar that it's important to have your family, your community. It doesn't have to be your family, it can be your friends, but somebody that sort of makes those interventions. And again, in certain countries, that has been done at community level. And those development of communities, yes, there is a cost to pay for that, but some of these interventions are actually not very costly, and they're about educating communities to pay attention to the environment around them. There was a beautiful example a few years back in Japan where one of the newspapers realized that they had a network of delivering of newspapers, especially to older people that still read the printed newspaper. And so they had an alarm system that would be raised when one of the newspaper delivery people saw that the newspaper weren't collected for 2 or 3 days. So sometimes it's simple things like that, and there is, as Ritu was saying, there is the possibility also of developing successful public-private partnership. The challenge, though, is to scale them up. So the little project here and there that works obviously is lovely, and they get money for a pilot project. But as I always say at ADI, it's great to see these nice stories, but how do you scale them up so that they really have an impact and they really then get taken into policy at governmental level?
I see people nodding when we talk about scaling up. Is there anything anyone would like to add or ask?
Well, I have a brief experience with my dad who had a terminal illness, but he had early dementia. And I was wondering about the mental health dimension of taking care of a person with dementia and speaking to the persons who they were rather than speaking to them today. And that how will that affect the mental health of the patient and not just the caregivers, and how that might, well, from my experience at least, might bring out this person in them. So mental health, basically.
I will say a few things, but I'm sure that you can answer that as well, yeah. So I'll just mention briefly that there are whole society experiments like the Dementia Friendly Community Movement essentially addresses those elements. It teaches people to look at the person with dementia as they are in the present and as they are in the past, and teaches people how memories are lost or maintained, so that there is a much higher understanding of why a person will react as they react. And I'm sure here we have another eminence that could speak for hours about that very topic. But I don't want to hog the panel.
Thank you. I just had one more comment regarding the mental health and caregiver burden associated with dementia. And as part of the Healthy Aging Initiative 2, we have a separate section on the cognitively impaired population, like we mentioned. And we have a helpline called Raha, which is available for the caregivers and patients with dementia. And psychological support is available as well as kind of system support, navigation of the healthcare system and psychological support.
And given that we are a partner of WHO, Dr. Ritu talk about it, but I don't know if we got the audio. They have developed some mechanism, I cope, I support, that sort of tackle that very point. We ourselves, DY, has worked in Asia Pacific on our Younger Carer of Dementia project, because we realize that younger people often, because the mid-layer has to go out and work, then the younger person is left with the care of the older person, and that can generate then mental health issues in the whole family. In all 3 generations, you can end up with various levels of depression, anxiety, panic attacks, according to the level of inadequacy or preparation of each individual towards the task that they have to embrace. And the Younger initiative, which has been taken on by ASEAN, which is an important multilateral mechanism in Asia, has been revelatory for us, because we really also have started allowing us to work at a much younger level. Indeed, there are some of our members that are now working on primary school education books in order to teach very little children what's happening to their grandparent, so that will prevent the onset of mental issues. So there is really plenty of really nice, simple, scalable. Often this works in hand-to-hand with the Ministry of Education, so try and adopt it then in schools.
Paola, thank you very much indeed. Any more questions here in the room? Anyone want to address the panel? No? Okay, so I just want to ask, as we begin to wrap up, what are some of the biggest knowledge gaps or priority areas for research in healthy aging?
I think there's a lot more work to be done. As you know, the elderly, they have multiple comorbid conditions, multiple complexities. One of the huge areas for research, I would say, is dementia. And I'm happy and excited to hear that there are options like the magnetic stimulation, which could help. Obviously, it needs more data. And the caregiver support is, at some point we have to say, okay, there is not much more we can offer as far as treatment. So if dementia management is an area of big research. The other one, obviously, is frailty. As we know, the older people, they lose their physiologic reserves, their muscle strength, bone strength, and frailty is a condition when they don't have enough reserves to bounce back up from any stressor like before. We do have research looking into the impact of frailty as well as management of frailty, because it will put a huge burden on the healthcare system.
Yes, and if I may add, the major problem in dementia research is detecting people who will eventually develop dementia before. So, for example, if you present to a heart specialist, you have high cholesterol, he will treat the cholesterol. He won't wait for you to get a cardiac infarct to treat it. And us as neurologists, we don't treat people with cognitive impairment in the same way. We start treating them when they start getting symptoms, and we know that's halfway through their disease. They've lost lots of neurons. So the idea, and I think the focus of research today, is to be able to determine who will develop dementia some 20 years later. And like Paola brilliantly said, you can build cognitive reserve. You can build pathways in your brain, and these pathways will delay the onset of clinical dementia once you've developed them. So if we could at least determine a group at higher risk, I think that would be a breakthrough in terms. And now we're reaching that stage. We have biomarkers, we can detect proteins in the brain, and most of the studies are done on people with genetic forms, the rare, very rare forms of dementia, where you know this patient will develop dementia, and they're trying all these new treatments before you actually get the symptoms.
If I can make one final remark, I mean, it's a massive issue. Basically, there is need for research at all levels. We keep saying, the 1% of the societal cost of the disease for each country should be devoted to research. Because really, we don't have research on biomarkers, as you were saying, at the diagnostic level. We don't know how, everybody talks about biomarkers in Alzheimer's and dementia, but they are not there yet. The research into risk factors, for example, we know that one of the risk factors is air pollution. Okay, and what are we going to do about that? Often I'm completely stumped when people ask, what do you do then about air pollution? It's a massive issue. We need to understand more about what in air pollution then makes you develop these. And pretty much all the way to a cure. Obviously, we are all hoping, at some point there will be a cure. But this is not necessarily healthy aging. Healthy aging is bigger than that, because not everybody will develop dementia. People will develop other things. People will just get frail. And frailty in itself, it's something that is important to our society. We need to understand. In a way, we need to develop behavior. We need to develop understanding of what is happening in an aging population. You said at the beginning, we are all going to get older, and we don't know yet at what point and level in our society we will develop the capacity to withstand, to be resilient at an older age. So I think in general we need to study more, and so we are grateful to WHO to do all this work that they're doing more in general on aging.
Paola, thank you very much indeed. Yes, I said none of us is getting any younger, but it's the same as you said, we're all getting older. So thank you very much to all of you here with us in the room. Thank you to those of you online watching on the stream. Thank you to our panel, of course, Dr. Shamila Shyamala, to Dr. Reshdeep Akhtar, to Paola Barberino, and thank you to Dr. Ritu Sadana for hanging on in there with the link there, the virtual link. Thank you so much. Shukran.